I've been on the island of Kauai for 24 years, working for Kauai Hospice as a registered nurse. Throughout all those years providing care, I came to the realization that medicine should treat the whole person, the mind, the body, and the soul. Following the principle of treating the whole person, the mind, the body, and the soul, I realized that the certifications which I had accomplished throughout the years needed to be filled in with something more, something that would integrate another field of integrative medicine. Integrative medicine is using a combination of therapies like healing touch, aromatherapy, sound healing, and music, and many more. Those techniques support your body's natural ability to heal. They integrate conventional approaches and complementary holistic therapies to achieve optimal health and healing. I've been asked by Kauai Hospice to work out a process by which we can introduce and use integrative care medicine and techniques in our daily care with our patients. Please have a look at this first episode of Healing Touch and be ready to look at more techniques that I will follow up with in further episodes on the subject integrative care. Thank you. Here we are today with Juliana, the Healing Touch nurse, interviewing Roy.
Hi, Juliana.
Hello. Do you like Healing Touch?
Yes, very much so.
Could you say that after the first treatment?
Yes, one of the things that surprised me is how relaxed and calm I was. I didn't realize that you left when it was finished. I woke up and you had already left. You told me I might fall asleep, and but when I woke up, I was refreshed and I felt a lot better.
Is it really like sleep, or is it more like a switch off reality?
I guess it was more like a switch off of reality. I was awake, but I was aware of things, and but my body was in a relaxed state, sort of a meditated state, I guess, where I was relaxed, calm, and very much at peace.
Or what did you think would the experience be like before you had your first treatment?
I really wasn't sure what to expect, but I kept an open mind, and I knew I was in good hands with you, and I just listened to what you had to say, and I laid down and tried to clear my mind, and you helped me clear my mind.
How would you describe Healing Touch to be different from a massage?
I think for me, it was more of a mental state, not so much physical, but physically, my body was relaxed. Mentally, I was calm, also relaxed mentally, and it was just a peaceful experience, I guess you could say.
It's just accepted these days in the medical profession, in all the hospitals. Did you know that?
I've come to believe that there is a mind and body connection and an energy. For me, I guess you could say it was a release of some of the, I guess, negative or like pain is a negative feeling, I guess, and what I was taking in was positive energy, I guess.
And do you feel that continuing the treatments for a while made a difference?
Yes, for me, I guess I was more relaxed. I was more calm. The pain was a lot less, and I wasn't really expecting much from it, but I was surprised at the results that I received from Healing Touch.
Would you recommend Healing Touch to other people?
Absolutely, it's in addition to if you're doing PT or exercising and stuff like that. I think it's a really good addition to overall health and well-being.
Hello. How are you today?
Okay, cool.
You good?
Yeah, you cool. You done.
Are you ready for a healing touch?
Okay.
Yeah?
Yeah.
Okay. I will start like always from the feet
Okay.
and I will go up all the way to the head.
Okay.
And I would like you to make a wish.
Again.
You don't have to tell me,
Okay.
just for yourself.
Yes, for me.
Okay, ready?
Okay.
Let's go. So I start from the feet, and I will not be talking very much, just a little bit to explain,
Yeah, yeah.
because the body is energy. All around our body is energy. And then there is areas where the energy is very strong. And we will go in every place and touch and make it nice and even.
Okay.
All right, so let's start. We are starting with the feet. As you can see, I am not massaging. I am just gently touching one hand at the feet and the other hand at the knee. And I'm holding it. I continue from the feet to the hip. Again, gently applying my hands over the body and feeling the warmth of my hand, giving that warmth to the body. Now I hold both hands on both hips. This is very calming. This is now the first energy center called the root. It's also called the root chakra, energy center. I hold one hand over that area, and the second hand I hold above it at a place between the navel and the root. That area is called the sacral chakra. And move on. One hand at the sacral area, the next in the middle of the body. That is called the solar plexus. The solar plexus energy is the powerhouse of the body. Moving up from the solar plexus to the heart energy. What a powerful energy. From the heart to the throat energy center or throat chakra. I will continue with the hands. The same I will do on the other hand. Shoulder, elbow, elbow, hand. And hang on to the hand in conversation. The patient is very calm, has his eyes closed, and seems very relaxed, in a state of deep relaxation. I move up from the throat energy center to the middle of the forehead, the third eye, up to the last area of energy, which is part of the body, holding one hand below and one hand at the crown energy center, third eye and crown. My patient now is resting with his eyes closed, and I will not disturb him until he opens his eyes. If my patient is so relaxed that he will not wake up, I will go back to the feet and tap gently. We are done. How was it? Did you make a wish?
Yeah.
Good. Thank you for the time, and I wish you a good health.
Okay.
I love you.
My sister Angela passed away on July 21st from terminal colon cancer. She fought a good fight. but it did take her life, and she lived a good life. And hospice became very involved, especially the last 2 months of her life, and helped her tremendously. And I met Nurse Juliana in May and knew this was going to be a good thing for Angela. And what my sister told me quite a number of times was what she wanted was to be close to people. She needed that, and she needed the hugs, and she needed the closeness, and I believe that's what touch therapy does. It's that added element for the patient who needs it desperately.
In her mind, that whole concept of holistic healing was very strong.
Yeah, absolutely.
And adding a healing touch and some alternative holistic measures into the hospice program
Yes.
was just perfect for her.
Yes. Yes. I don't think we can express enough that a person isn't just a physical person. They're an emotional person. We have emotions. We have mental thoughts. So much more than just the physicality. And those things can actually affect tremendously our physical being. And so bringing those elements in, I just think were so important. Even though the end result in my sister's case was death, the journey along the way was so important. The key to transitioning is to really treat the whole person. Treat truly the whole person. I knew there was a connection, or there was going to be a deep connection. So the next time, Angela was much more receptive. And that might be true for many people. I mean, when you don't know something, it's like you might be a little resistant and think, oh, I don't know if I want somebody touching me or massage. You don't know. But once you experience it and you kind of just let your guard down, or let the love come in, it makes a difference. And then it's like, okay, I'm okay with this.
I am here with Vishal Goyal. He is a MD and a palliative care hospice and palliative care nurse board certified doctor here on island in Kauai.
Yes.
And this person who is here is Apollo, that is his assistant. He is very important.
Absolutely. He provides a lot of emotional support.
Yeah, and we know that in our conversation, we might even mention that because we know how healing animals can be for our patients.
Absolutely. Absolutely. I think, from what I've seen, a lot of patients have strong bonds to their pets.
Yeah.
They treat them like family. So
Yeah.
oftentimes trying to include family in the plan of care is very important. So we try to make some exceptions at the hospital and things if we have to.
Yeah.
And then also, even for people who don't have pets,
Yeah.
they have strong affinity to animals as well. And right now, actually, at the hospital, we have a therapy dog. Her name is Star. She was specifically trained to be a therapy dog in hospitals. She's a black Labrador. She's the sweetest ever. She's good friends with Apollo.
Yeah.
And so she makes rounds in the hospital. She has her own badge.
Yeah.
So she's an official employee. So yes, I
Yeah.
totally agree. I think animals, for the people who feel connections to them, can provide a lot of healing.
Yeah. Yeah, that's a good introduction. Tell me what you think about healing touch.
Yes, absolutely. So I think, just as I was saying with treatments like chemotherapy, there are benefits and there are also side effects. This is true of most of what Western medicine has to offer. And it's also true of a lot of the medicines I prescribe. So, oftentimes, if a patient has pain, I may prescribe an opiate, which will likely help with pain, but may result in some drowsiness or constipation or some other side effect. Similarly, with anxiety, we do have great medicines, um, but oftentimes those can make people sleepy and not as interactive. So, when we consider other modalities like healing touch, they provide a great advantage because the research shows that healing touch can help with pain management, and if we can address pain management with healing touch, then perhaps we're using less opiate medication and there are less side effects. Um, and again, similarly, research shows that for anxiety, modalities such as healing touch can be very helpful. And, when we approach the end of life, oftentimes our families want to be able to interact with us, but they also want us to be comfortable. So, if we have to make the choice of making someone a little sleepy to make sure that they're comfortable, we will. But having an additional tool such as healing touch, I think is such a great benefit because it's not available everywhere and not everyone is familiar with it. So to have another tool in the toolbox, I think is just really great for the community. And it helps the nurses, the doctors, the rest of the team come up with a care plan where we're focusing on the comfort of the patient and also minimizing side effects.
What can you tell us about energy?
So, it's hard to talk about things we don't know how to measure. And I think that's why often in Western medicine or traditional medicine, we stray away from topics like this. In general, I can't tell you what it is or how it works, but what I can tell you is that people do better when we use it. And ultimately, in palliative care and hospice care, we're often focusing on the result, right? So sometimes we don't know exactly why something is working, but we know it works. And if we know it's not producing harsh side effects, I think that uh, then it can be added to our toolbox, right? And so I would just say that, at a time in life where comfort is key, that we are encouraged to use all the tools we have. And, it may work for some people, it may not work for others, and that's okay because there aren't many side effects or any side effects really. Uh, and I think that, again, it becomes, I can understand why people may think that there's a spirituality component or a religious component. But I would just say that, from a human experience perspective, we all know that there are things we don't understand. And we know that there's some intersection of science as we understand it and the unknown. And I would encourage people to consider these as alternatives or add ons to what their doctors are suggesting.
Do you refer sometimes patients for healing touch, or we haven't had it yet available so much?
Yeah, that's a great question. So I think historically I've been pretty open to integrative approaches to medicine, especially when everyone is working together. I would highly recommend that you follow the care plan of your doctors and your nurses and your pharmacists. However, I do think things like massage therapy, acupuncture, healing touch, music therapy can all be beneficial. again, we don't quite understand all of those things. And I've worked periodically with each of those kind of areas of integrative medicine. I think the hardest part for me has been the availability, because sometimes these things are very expensive as add-ons and they come out of pocket because most insurances aren't quite covering these things, although they're starting to with acupuncture and a few others. Um, so, I think the fact that the community has access to something like this is amazing. And, it would be something that I would, consider for certain patients. And like I said, it doesn't have to be for everyone and it may not work for everyone. But I do think that in combination with a comprehensive care plan, it could be very helpful. And oftentimes the barrier is availability and cost. So to have it, as part of hospice care, I think would be just such a great benefit for the community.
Energy is all around me. Energy is within me. Just sitting and taking in the energy is health in itself.